I think the main idea of the book is what ails Pakistan's health systems, and this is a collection of articles I have contributed to different publications over the period of last 10 years. And I mean, most of these articles were written in response to some sorts of health crisis or health challenges that came up in the country. And I mean, this was a response to analysis of those problems and how we can put things right in the. So if you look at the book, it covers a whole range of issues, from sexual reproductive health to health systems financing, and other issues on NCDs, like non-communicable diseases, on cancers, and also on some of the health hazards which do harm to the consumers, like instant scandals, and also some of the issues around ingestions of harmful medicines. So I think the range and motivations, they have actually arisen from the main health problems that this country faces, and also it suggests some of the policy solutions, in terms of more funding, in terms of regulations, and also issues around privatization of healthcare. If you look at the title, it is double-edged, it says that most of Pakistani suffers from ill health. So Pakistan, the patient base, the people who suffers from ill health in Pakistan is very broad based, and also Pakistanis have showed exemplary patience, in regard to malfunctioning health system. So this is related to the title. As to the subtitle, this argues for the universal health coverage for all people, and that would require reforming and fixing the healthcare system. Yes, I am a medical doctor, so I have deep interest in these issues, plus I have also background in public policy and public health. And I think in Pakistan much of the focus of healthcare system is on the curative side, and I think the broader policy and public health approach is lacking. I also worked as chief executive of the network for consumer protection, which is one of the major health NGO, and that really drew me into this work. We worked on nutrition, tobacco, and also intellectual property rights issues in Pakistan. So that was also motivation to get more engaged in health policy challenges, and policy and research advocacy work. This work was further reinforced by my engagement with multiple donors in the country, and that also got me into broader policy challenge. And also having worked in different countries in the Middle East, in the UK, and in Europe, that also added in global perspective to my work. And for example, diabetes in Pakistan is a huge problem, but there is no national program to deal with it, as there are programs in other countries. So these are different chapters, and I think some of the topics are quite new to Pakistan, and not much discussed. For example, the issue of drug pricing, access to medicines, and intellectual property rights. I think these are very basic issues which impinge upon the right to health and also access to health issues. And this is inextricably linked to the issue of universal health coverage. So all these issues are bound up with each other, and this book takes a very broad view of Pakistan's big health problems, and offer some policy solutions and policy suggestions